My name is Darst. I'm the owner and operator of Midwest Regional Health Services. My career started back in 1977 when I was a med student at Nebraska. Took my residency in internal medicine at Nebraska and then started on staff at Clarkson Hospital as part of Internal Medicine Associates. That ran for about 20 or 22 years. And I left there to start Midwest Regional Health Services, and it grew from me by myself up to 8 physicians. We are the first patient-centered medical home that was certified by NCQA in Nebraska, and we're real proud of being where we are in primary care. Internal medicine is the opportunity to treat very complex diseases. I like complexity. I like how things interact. I'm fascinated by nature, by physiology. The more complicated the patient, the better I like it. When I sit down with a patient for the first time, I realize this is the first opportunity I have to make an impression on them, so of course we're on our best behavior. But what I'm really interested in is getting to know what the person is like. Osler once said it was more important to know what kind of patient this disease has than what kind of disease this patient has, because all of us are different. And the approach that we take for people, the approach we take for taking care of their disorders, has to be individualized based on what those patients have as values, what those patients think is important, and what sensitivities they have. That way we can take good care of them. Well, my relationship with Nebraska Medicine goes back to 1975 when I started medical school, residency there. I entered practice with Internal Medicine Associates. They were part of the teaching program for the Med Center, and back in those days, all of the people that developed Nebraska Medicine into what it is today were people I rubbed shoulders with. It was really a fun experience. Down through the years, I've had lots of contact with the Med Center, and being a private practitioner, I've never been really included as part of the academic environment, but always have enjoyed the association that I've had with the academicians that I've associated with. What drew me to medicine is a real hokey story. I was sitting in the front yard of my grandpa's house. I was 5 years old, and my grandfather was a foundryman. And he held up my hand. He said, "You see this hand, Jeff?" That was my nickname in those days. He said, "Those hands are going to cure people someday." And that planted the seed that I was going to be a doctor at age 5. So throughout my entire career from kindergarten on up, I was always fascinated with science, focusing on medicine and how I might eventually become a doctor.